So, ladies and gentlemen, please help me welcome Dr. Glenda Arquiza. Hi, Ma'am Glenda.
Hello, good
Hello.
morning.
Good
Can
morning
you hear
po.
me?
Yes
Okay,
po.
good morning. Thank you for that very generous introduction. No, I always feel nervous after Dr. Gapos because Dr. Gapos is a hard act to follow. Okay, I want to start my presentation with these two stanzas from my all-time favorite poems, Invictus, by William Ernest O. Henley, which says, I am the master of my fate. I am the captain of my soul. Meaning, what you are is your own doing. Okay? So my question to you is, you alone is responsible for what you have become. No? So my question is, what matters most to you right now? Is it to enter into a relationship or to pass the nurse licensure examination? Or probably to top the NLE? So how would you achieve what matters to you most? Benjamin Franklin, one of the founding fathers of the United States of America, who was a printer, a scientist, a statesman, and a writer, years ago in his time, he set to discover and prioritize his values. So he made a plan for attaining moral perfection. So he listed 13 virtues with their precepts, and he planned to imitate Jesus Christ and Socrates. So to achieve his intention to acquire the habitual or the habitude of all these virtues, he made a little book in which he allotted a page for each virtue. The 13 virtues he listed were: first, temperance; two, silence; three, order; four, resolution; five, frugality; six, industry; seven, sincerity; eight, justice; nine, moderation; 10, cleanliness; 11, tranquility; 12, chastity; and 13, humility. So inspired by Franklin's little book, a namesake of Franklin, a namesake uh, by the name of Franklin Covey, the recognized leader in life and time management, developed the productivity pyramid model, which uses a tool called Franklin Planner. But this is another activity for you. But going back to uh, Benjamin Franklin uh, plan for moral perfection, as I've said, uh, he has this little book. So, for example, in one page, he would write the virtue of humility. So, on the opposite page, he will write what humility is. So, what do you mean by humility? You have heard Dr. Gapo's lecture, no? And it he is amazing, isn't he? But in spite of the many achievements of Dr. Gapos, he remained humble. No? So one of the virtues of Dr. Gapos is his humility. So what do you mean by humility? that is freedom from pride or being humble. So I hope all of you will be like Dr. Gapus. I'm sure most of you have been interested or have been inspired by his lecture. So Dr. Gapus will be a very good role model to all of you. Okay, now I'll go to my task for this morning, which is procedural updates on the nurse licensure examination. Okay, when is your examination? November 18? Is it November 18? Okay, but anyway, the issues and concerns that will be presented are clustered into 4, such as the NLE test framework, the NLE subjects, the test requirements and procedures, and the post-NLE procedures, passing mark, and retake policies. Okay. So I'm going to discuss with you the NLE test framework. So when you say test framework, this is the guidelines, no, for the test. So the present NLE test framework is based on the 11 key areas of responsibility. Okay, so a nurse should demonstrate competence in. This is based on CHED Memorandum Order number 14 series of 2009. So this, I'm sure you are all familiar with this, the 11 key areas of responsibility. So these are safe and quality nursing care, management of resources and environment, health education, legal responsibility, ethico-moral responsibility, personal and professional development, quality improvement, research, record management, communication, collaboration, and teamwork. These 11 key areas of responsibility are classified into 4 general competencies, like quality patient care, enabling competencies, enhancing competencies, empowering competencies. Okay, next slide, please. Okay, the future NLE test framework, I hope all of you will pass the November examination, because this will be the last examination that will use the test framework that I have just described. No? But for the future NLE test framework, it will be based on CMO number 15 series of 2017, which will use the 14 learning outcomes of the BSN program, which are, and also it will take into consideration Republic Act number 10968 or the Philippine Qualification Framework Act. Okay, so this will be the PQF will be taken into consideration. It has 3 domains: knowledge, skills, and values, application, and degree of independence. Okay. Next slide, please. Okay, so these are the PQF descriptors. As I've said, there are 3 domains: knowledge, skills, and values, the application, degree of independence. Knowledge, skills, and values will comprise 20. 20% application, 50%, and degree of independence, 30%. Okay? Whereas in the in the present framework, the safe quality patient care will comprise 60%, and the rest of the competencies, the three, would have 10% each. Okay. Next, please. Okay, this is just the Philippine qualifications framework, wherein in the Philippines we have level 8. From level 1 to level 8, Malaysia has level 9. So as you can see, after grade 12, you will now have leveling, no? So level 1 to 5 will be under the TESDA, and then level 6, 7, 8 will be under the CHED. Okay, and then 1 to 4, up kindergarten to grade 12 will be under basic education or DepEd. Okay, just for your information, this will not be given in the test, I'm sure. Okay, so what will be covered in the future NLE test based on the framework? So as I've said, the future NLE test will be based on CMO number 15 series of 2017, or the 14 learning outcomes of the Bachelor of Science in Nursing program. Okay. Next, please. So these are, you have the program outcomes. For example, the first learning outcomes is apply knowledge of physical, social, natural, and health sciences and humanities in the practice of nursing. The performance indicators are integrate relevant principles of social, physical, natural, and health sciences, and so on. So from 1 to 14, there are performance indicators, about 55 indicators, I think, 55 or 56, but anyway. Okay. Next, please. Anyway, you are not concerned with this, no? But it's nice to have this information. So in case you failed this November examination, you will be tested on this already. So it's nice to, at least you will be prepared what to study later on. But I hope all of you will pass, because probably there will be this will be a harder exam, because this will be the first time that it will be this framework will be used for the June 2022 nurse licensure examination. Okay. Okay. So I talked about PQF a while ago. We are concerned, the professionals are concerned with level 6, 7, and 8. Okay, when you pass the nurse licensure examination, you will be classified as a level 6 professional. After probably 3 to 5 years, you will be classified as level 7. I want to tell you that for level 7, the educational qualification will be a master's degree in nursing. And for level 8, a doctoral degree. Okay. Next, please. Okay. So as I've said, the new NLE framework will be used for the first time for the June 2022 NLE. Okay. Next, please. Okay. I'll go to the next section, the NLE subjects, passing mark, and retake policies. Okay. So, there are 5 tests. No? Nursing practice 1, which is community health. Nursing practice 2, which is maternal and mother-child nursing. Maternal child nursing is now termed as mother-child nursing. No? Nursing practice 3, it will consist of concepts on oxygenation, fluid and electrolytes, infectious diseases, inflammatory and immunologic response, and cellular aberrations. Nursing practice 4 consists of concepts on nutrition and gastrointestinal metabolism and endocrine. And nursing practice 5 will consist of alterations in neurologic, sensory, and musculoskeletal functions and mental health and psychiatric nursing. Okay, the question here is what part of the test is most difficult? Which one is the easiest? I cannot tell you point blank what is the most difficult, what is the easiest. But for the last few years, nursing practice 5 is always or always got the lowest mean score. No? Nursing practice 5 is as I've said, neurologic, sensory, and musculoskeletal functions alterations, and mental health and psychiatric nursing. But I noticed also that those who make good in 5, no, in nursing practice 5, are graduates from universities who have very good clinical experience or related learning experience in psychiatric nursing because they have psychiatric nursing in their base hospital. No, like for example, UST, UP. Especially UST and UP, no? Because they have their psychiatric ward in PGH, they have psychiatric ward in UST, also Makati Medical Center. Okay, so it really depends on how you were prepared during your BSN program, no? Or when you were students, no? Okay. So the foundation is very important, no? And the learnings, the past learnings that you have gotten from your program, no? So I think sabi ni Dr. Ray kanina, yung mga knowledge niyo, past knowledge niyo, very important. I noticed, I read from the chat, sabi, favorite ng BON research. That is a myth. It's not true. No? Maraming research because for every nursing practice, the 11 key areas of responsibility is integrated. No? So aside from the concepts that I have mentioned, yung 11 key areas of responsibility is integrated, no? It has 5 questions each. For example, 5 questions in communication, 5 questions in research. So 5 times 5, 25. So meron na kaagad 25 questions on research, no? So akala ninyo mas maraming research because minsan yung nursing interventions, we use evidence-based nursing. And you know, ang competency in evidence-based nursing is competencies nyo in research. So hindi totoo na ang BON paborito yung research, no? Kaya yun, maraming research. You would notice also later on, maraming communication, no? So yung second part kasi ng test is on the 11 key areas of responsibility. Okay? So 50 doon sa mga concepts and then 250 and 250 because this is a 500 item test, no? So 250 doon sa 11 key areas of responsibility and then 250 doon sa mga disease conditions. Okay? Fundamentals of nursing, pharmacology, what else? Anatomy and physiology, these are integrated, or biochemistry, chemistry. These are integrated in all subjects. Okay? Next please. What is the passing score in the NLE? The passing score in the NLE is 75%. Do I need to get 75 correct answers out of 100 items to get? No. These are transmuted, no, based on the performance of all the examiners or examinees rather. Okay? So, but iyon, 75% ang passing, but it does not mean that you get 75 correct answer out of the 100. Okay? First, if you get a score of less than 60%, then you failed in that subject and you will be considered conditional. No, you will not pass, but you will be on condition. So the next examination, you just take the subject that the nursing practice that you failed. For example, if you got a score of 58 in nursing practice 5, and then the next time that you take the NLE, you will be taking only the nursing practice 5. Okay? Next, please. If I finish the first day of the exam and gets absent on the second day, will I be considered failed? No, you will not be. Or if I obtain a passing mark on all subjects on the first day and decide to take just the second day test in the future, will that be allowed? No, it won't be allowed. No? You have to repeat the exam from a nursing practice 1 because you will be considered not, you will be considered as somebody who did not finish the exam. Okay, but you will not be, your paper will not be checked. Okay. Is fundamentals in nursing a separate subject? It is not. As I've said, it is integrated in all subjects. Okay. So I think the technique here is you try to find out, for example, in maternal child nursing, what are the commonly used procedures? Okay. Is it the care of the newborn? Is it care of a woman in delivery? Okay. So you just try to find out what are the most commonly used procedure. Like for example, in respiratory, what is the most common procedure in respiratory conditions? Probably care of tracheostomy, di ba? Okay. Okay. Next. What subject in the NLE carries the greatest weight? All the subjects have the same weight. Okay. So there, for each nursing test, there are 100 items. So nursing practice 2 will have 100 items also. Nursing practice 3, 4, 5. As I've said, there will be 500 items in the NLE. Okay? What advice can you give us on what things to focus on for the NLE? You focus on the subjects or on the concepts which you think you are weak at. Okay? Siguro naman, for example, oh, by the way, pharmacology is also integrated in all subjects. So if you think that you are very poor in pharmacology, especially on computation, then you focus on computation, no? Okay. You know yourself, no? You know your strengths and weaknesses. Okay. Okay. Next, please. There are social media sites and posts claiming to be a source of questions in the NLE. What can you say about this? Okay. That is not true. No? No? Before the exam, maybe 2 days before the exam, the members of the BON are placed on quarantine. Hindi pa nagko-COVID-19 pandemic, nagwa-quarantine na kami, no? When we started in 2014, we were quarantined for 14 days, for 2 weeks, no? Okay. So there is no way that yung questions will be leaked out, no? Kasi as I've said, 2 days before the examination, the Board of Examiners, the board, no, the BON, are quarantined without cell phone, no? As soon as we enter or before we enter the quarantine room, our the cell phones are left with the NBI. So there are 3 security men, no, from the NBI, from the PNP, and from the internal security. Okay? So there is not, that is not true na yung mga nagsasabi na these are the questions, no? You would notice yung mga ano nila, mga post nila, common knowledge naman na the framework is from the 11 key areas of responsibility, no? These are common knowledge na sa nursing practice 3, oxygenation, fluids, and electrolytes, no? So wag kayong maniniwala. Merong isang review center na ipopost pa yung picture, no? Nakasama nila yung probably former member of the Board of Nursing, no? And sasabihin na, kaibigan niya, and then before the exam, ano siya, na ito ang lalabas, no? So, hindi totoo yun, no? Ano lang sila, nagpapabilib. Okay? So, you ask Dr. Gapos, hindi totoo yun. Okay? Okay, kung meron mang leak, no? Talagang ano yon, hindi siguro masasabing aksidente, pero talagang inano na yon, probably inside job, but not from the Board of Nursing, because supposed to be lahat ng Board of Nursing members are men and women of integrity. Okay? Okay, next. Okay, test requirements and procedures. Okay, test requirements and procedure. What is the proper attire for the test? Can I wear a scrub suit? Do I need an RT-PCR test result to be able to take the test? Okay. You are required to wear a clinical uniform or at least a white dress, no? Okay. Yung clinical, clinical uniform. Okay, not the school uniform. Okay. So, what are the requirements? It is contained in Professional Regulation Commission Memo number 68, series of 2020. Next slide, please. This one. Important reminders to all examinees of various licensure examination. Okay, so pursuant to Professional Regulation Commission Memorandum Order number 68, series 2020, or the standard guidelines on the strict health protocols to be observed in the conduct of licensure examination during the COVID-19 pandemic. All examinees of various licensure examinations are reminded of the following. So this is true to all licensure exam, no? Not only for the NLE. So examinees shall bring the following during the scheduled licensure examination: notice of admission or NOA, pens, pencil, and eraser. Pencil is Mongol number 2. Is it number 2? Number 2, no? Okay. then negative result of the reverse transcription polymerase chain reaction test, or RT-PCR test, taken from 3 to 5 days prior to the scheduled examination or certification of quarantine for 14 days or its equivalent, signed by any of the following: any licensed physician, whether from government or private, a municipal health officer or provincial health officer or city health officer, barangay officer visiting the examinee's residence, attesting that he or she has been in quarantine for 14 days, informed consent form, and health declaration form. These are downloadable from the PRC website, no? prc.gov.ph. Then face mask, preferably N95, and face shield, which you should be wearing all the time. Okay, and then 70% ethyl alcohol for regular hand disinfection, and then pre-packed meals, snacks, and drinks. Okay, next please. Examinees shall submit the post-examination health surveillance form to the concerned regional office 14 days after the conduct of the examination. Anyway, this is post NLE already. No, but I'll just read this. In the event of failure to take the scheduled licensure examination, wherein your name is already included in the room assignment, no? The examinee shall be allowed to take the immediately succeeding scheduled licensure examination subject to the following. 1. For those with health-related reasons, the examinee must submit a letter to the commission and the concerned board together with a notarized medical certificate. For those with travel restriction-related reasons, the examinee must submit a letter with attached official letter or restriction from the local government unit concerned. Examinees who cannot take the scheduled licensure examination for any reasons other than those stated in item C, meaning you are sick or travel-related restriction, may submit a request to the commission for them to take the next scheduled licensure examination, stating clearly the reasons of their failure to take the subject licensure examination. The written request shall be submitted through the official email of the concerned regional offices. No, https colon www.prc.gov.ph/regional hyphen offices hyphen contact hyphen information. Said examinees are advised to keep their notice of admission and official receipt for use during the examination. So for queries and concerns, please email licensure office at licensure.division at prc.gov.ph and licensure.office at prc.gov.ph. Okay, next please. Next slide, please. Okay, are we allowed to write on the questionnaire? If the questionnaire lacks a page, what should I do? Okay, you are not allowed to write anything on the questionnaire. So if the questionnaire lacks a page, you go to the watcher and tell him or her that you lack a page. If typographical errors occur, can the questions be considered a bonus? Okay, well, if it is just a typographical error and you can still, I mean, it does not affect the statement, no? It can be considered a bonus, or it can be considered as a valid question, no? Of course, this is a post NLE already, no? So the members of the board will decide on this, no? If the typographical error affects the statement, then probably it will be considered a bonus, either a bonus or a or they will not consider the question, no? So it's a minus. So but usually we are only allowed two minuses, no? One bonus, one minus. So at least we should have 98 items. Okay. So if it is invalidated, then it is not considered. So -1 yung item. Okay. If it is a bonus, all will get it, no? Okay. Or all answers are correct. Can we shade the answer sheet in a circular manner? What should I do if I inadvertently bore a hole on my answer sheet while shading? Okay. So I think you were taught how to shade, no? There are a lot of stories about this, like they said that, you know, if you just put a dot in two answers, for example, no, hindi daw mariread nung machine. Hindi totoo yun, ha? Okay? Mai-invalidate yon yung answer. Okay? Yung inadvertently bore a hole, hindi naman yata yun, it cannot happen inadvertently. Okay? Kasi, unless nagigil ka na nag-shade. I think you can ask Dr. Gapos on the Q&A how you shade. Kasi I understand there is a technique of shading. Okay? But
Yes,
I'm not aware of that.
Yes, ma'am Glenda. Okay. Yung inadvertently bore a hole po, yun po yung nahulog na Christmas decor dun sa answer sheet ng isang estudyante. But ginawa niya, pumunta lang siya sa proctor. And then yung shading, dapat consistent and with the right pencil. Ayun po. So if it's gonna be 3 strokes ang ginagamit, 3 strokes all over dapat from item number 1 to 100. Hindi pwede na 3 strokes ka sa number 1 tapos sa number 2 ginawa mong 1 stroke na lang. So hindi po magiging unequal po yung volume ng lead doon sa spots po ng option. So the best po talaga consistent. So I suggest that they count the number of strokes that they do when they're shading.
Okay.
So it has to be consistent all over. Yun po, ma'am.
Okay. Thank you.
Okay po.
Are we allowed to erase and reshade an answer? Yes, you can. But like, when you erase and reshade, when you erase, be sure that you will not tear the answer sheet. And then yung ang reshade an answer, as Dr. Gapos has said, be sure na you are consistent, no? So pag hindi ka pa sure sa answer mo, wag ka munang mag-shade. Will there be an effect on our scores if we frequently erase on our answer sheet? I think there will be, kasi baka yung mga in-erase mo hindi masyadong na-erase, no? And then the machine will read yung mas klaro na na-read niya. So be careful when you shade, no? Okay? Or when you answer, so that you will not be erasing. Okay? Okay, next. Can I take the test in the province even if I graduated? Yes, you can. I know there are a lot of graduates, who take their examination in Baguio. Kasi doon na din sila nagre-review kasi malamig, no? Magandang mag-review. So it does not matter where you graduated and where you want to take the examination. Okay? Next. What should I do if I lose my notice of admission on my way to the testing center? You just have to have a notice of admission, because without it, you will not be allowed to take or to enter the testing center. So do not lose it, no? Ano na yon, carelessness na talaga yon. Okay? Unless na hold up ka. No? Okay. Next. If I pass the NLE but I'm not satisfied with my rating, will I be permitted to take it again? No. There is no provision for this. Okay. Next. If I inadvertently tear a part of my answer sheet, will it be invalidated? Or as pareho lang ito yung inadvertently put a hole, no?
Opo,
Okay.
ma'am.
So punta ka lang, go to the proctor and bring to her attention your concern. So probably you will be given another answer sheet, no? Okay. But anyway, the proctor will attest that as long as probably yung corner lang ang napunit, probably you will be allowed to go ahead, no? Okay. Pero bakit mo naman mapupunit, no? Can the quality of my shading on my answer sheet affect my score? Yes, probably Dr. Gapos can answer this.
Yes po, ma'am. We did an experiment. Pagka inconsistent po yung shading, may mga deductions po dun sa score. Tapos pag marami po masyado yung erasure, siguro nahaharm po yung texture ng
Yeah.
answer sheet. Nagkakaroon po ng deduction at yung nakita po namin na ratio, if your erasure harms the answer sheet, one large erasure could amount to as much as 4 deductions in terms of the point. So malaki.
Yeah.
So kung isa lang naman yung let it go na kasi minsan tayo nasasagot namamabilisan na lang. Siguro ma'am ang suggestion ko, they do the shading per situation. So they answer muna questions 1 to 5, then after 5 item number 5 magsi-shade na po sila kaagad. Tapos meron pong tanong dito sa atin ma'am, I think ito masarap na i-clarify natin kasi sabi niya dito, meron daw pong post sa Facebook that starting this December 2021, computer-based licensure examination will be implemented. Is this also applicable to the nursing program? Ngayon, hindi naman po niya lininaw kung yung announcement ay related to what specific board exam. But based on our experience, nag-i-inform naman po ang Board of Nursing. They are kind enough to orient examinees, provide information dissemination sa schools. Kung wala naman nangyaring ganon, I don't think they will jump the gun into offering a computer-based exam right away because this requires a lot of orientation, di ba po ba ma'am? So I suggest itong ating mga examinees, do not burden yourself with mga fake post na ganito. Kasi baka mamaya yung sinasabi niya na computer-based licensure, saang bansa yan? Pwede yan na sa Middle East, pwede yan na yung sa NCLEX magbabago ng framework. So hindi po pwede na bubulaga po sa inyo na bigla na lang computer-based. Hindi po ganun ang ating gobyerno. So dito po sa atin, organized po yung PRC. Kung may pagbabago, based on our experience, kahit kami, nai-inform na pwede ba sabihan nyo yung estudyante nyo na ganito yung gagamitin. So may announcement silang ganun sa lahat ng sectors. So once again, yung pong mga naniniwala sa mga nakikita sa Facebook, wag nyo na pong ipas sa mga friends nyo. It doesn't make any sense burdening yourselves with anxiety. Ma'am Glenda, your thoughts po?
Yeah, I don't think they are ready with the computerized, no? Because when I left last year, no, it has been a year that I left the board, no? Wala pang they have not planned for it, or they have not they are still on the planning stage, and they are still looking for a supplier, no? I mean, for a server, I mean. No? So, wala pa. Probably, siguro, mauuna yung engineering, ganon, kasi mas maano. But as of now, wala. Hindi totoo yun, no? You know, it will take some time pa kasi marami pa yung testing, no? May pilot testing pa yan no? But tama si Dr. Ray na wag kay, especially doon yung mga mga post na ganyan, mga fake news usually, no? Especially from mga yung fly by night na review centers, no? So tingnan ninyo yung yung mga may-ari ng review center, no? Okay? Kasi nga laging doon nanggagaling ang mga issues, no? Pero wala pa talagang computerized, hindi pa magko-computerized. No?
Thank you, Ma'am Glenda, for clarifying that. Meron din po tayong nalilitong estudyante dito sa ating direct question. Sabi niya, Sa Cordillera daw, which means sa Baguio, no need to take the RT-PCR. Okay, wag po kayong ma-confuse. Iba po yung requirement ng LGU sa requirement ng PRC. Tama po ba, Ma'am Glenda?
Yeah,
So
oo.
kung yung pagpasok mo sa Baguio, oo, kasi taga Baguio din po ako, hindi na
Oo.
natin kailangan magpa-RT-PCR. Pero kung mag-i-exam ka, kailangan mo pa rin based sa PRC guidelines. Huwag niyo pong
Yes.
i-generalize yun. Nalilito na
Oo.
po sila.
Yun nga. Tapos, no, para wag kayong malito, yun lang, ang tingnan lang ninyo, if it is official announcement from the Board of Nursing or from the PRC. No? Okay?
Opo.
So, yun yung mga official announcement. Siguro doon sa licensure division or sa licensure office. No? So, you want to know sino ba yung ng licensure office, sino yung head. I'm not familiar anymore with the heads, no? But dapat doon lang manggagaling or probably sa regional director ng PRC.
Opo,
Okay?
thank you very much po. Again, reminder po sa ating mga examinees, iba po yung requirement ng LGU sa requirement ng PRC. So, you need to comply with both. Kung kailangan nyo ng RT-PCR sa LGU and sa PRC, well and good. Isa na lang. Ngayon, if the LGU doesn't require you RT-PCR, it does not necessarily mean na PRC would also not require you. So, wag nyo pong pinupost na dito sa amin hindi na required kasi misinformation, baka may umasa na ganon, hindi makapag-take ng exam dahil hindi na siya nag-RT-PCR or hindi na siya kumuha ng certifications. Please be guided by the instructions. Intindihin po natin na maigi kasi the technical side of taking the test during this time of a pandemic really requires us to be reflective of what we read. Okay, ito pa meron tanong yung isa, related po sa na-discuss mo na. What if an examinee fails to pass the letter? What if the reason for not taking the exam is not valid? Is he or she allowed to take the succeeding examination? So I think this is moot and academic from what you explained. So you only said valid. So kung hindi po valid, hindi na po kayo papayag. Mag-apply po uli kayo. That's plain and simple, moot and academic. O kung wala po dun sa binanggit ni Ma'am Glenda, wag po tayong mangonsume sa mga hindi pa nangyayari. The test is stressful enough. So yung mga what if natin, what if hindi allowed, edi hindi po talaga allowed. So you will apply again. Tama po ba, Ma'am Glenda?
Yes. Common sense is not common. Ito meron. For example, nag-positive po sa kung nag-positive daw sa PCR test, kung ang NOAA daw, pwede pang Yes, I said it, di ba? Na if you are not able to, kung nandoon na yung name mo in the assignment of rooms, no? You can take the next exam. And as I've said, you keep your notice of admission and your receipt to be used in your examination, your next schedule. Will I be allowed to use a calculator? No, you are not allowed. Okay? So, you review your division and multiplication.
Ma'am Glenda, meron po kasing bagong in-approve na test, yung saliva test, pero wala po sa PRC guidelines. I suggest, I think they have to verify sa PRC, pero as a matter of protocol, what is in the guidelines ng PRC is RT-PCR talaga or the quarantine certification. So it was not mentioned that the saliva test, although I do understand po sa inyo, mas mura po talaga ng malayo yung saliva test. But doon po tayo sa siguradong hindi tayo magkakaproblema. So the guideline says RT-PCR. So I think we have to comply at the moment. Suggestion po.
Okay. What are the common errors committed by NLE takers? What advice can you give? Okay, the common errors are there are two sets of tests, A and B, no? So if you are assigned to set A, no, it should be consistent for all the 5 examination. So if you started with set A sa nursing practice 1, be sure that when you take the nursing practice 2, you will be given set A also. Okay? Kasi pag ano nun, pag-checking noon, iba ang answer key ng test A at saka ng test B. Okay?
Ma'am, may tanong po dito, Ma'am Glenda.
Okay.
Lahat daw po ba ay multiple choice?
Yes, lahat.
Okay. Tapos yung CHN daw po ba ay separate category
Yes,
pa rin?
It is nursing practice 1.
Opo.
Community health nursing. Okay? Okay, ito, there should be no erasures on the answer sheet because the OMR will invalidate it, no?
Opo.
So, yun. Tsaka no marks, phrases in the answer sheet, no? Okay, or even in the questionnaire. Okay?
Ma'am, may shinare po yung isa nating examinee. Nag-email daw po siya sa PRC, NCR about the saliva test and pumayag naman daw po.
Pumayag?
Opo.
Okay.
Kasi bago lang po yun, ma'am, na na-approve. So siguro yung nung na-formulate yung guidelines, hindi pa po nila na-consider.
Siguro. But be sure na ano ang nag-answer talaga.
Yun nga, ma'am. Yun ang mahirap doon kasi baka mamaya pagdating niya doon biglang sabihin hindi valid, sayang naman.
If you got 75% overall rate and got less than 60% sa specific next time around po. Di ba sabi ko, even if you got 75%, no? Pero you have a score of less than 60% in one test, kuwan ka, condition ka, no? Okay, so you have to take the practice test that you failed the next time that you take the exam. Yung 4 hindi na, yun na lang isa.
Ma'am Glenda, in relation to that, meron po dito sa ating direct question. Napakagandang tanong po kasi I think very applicable. What if nag-take na daw po siya ng 2010 and then na-failed sa NP3 and 4? Nakalagay conditional. Will I be going to take the exam again for NP1 or NP5? I'm considering more than 10 years na conditional pa siya nung last exam niya. Paano daw po yun?
I suggest that you take the whole exam na kasi iba ang ano noon.
Framework, opo.
Iba ang framework that time. Ang framework that time, yung pang...
yung ano ma'am, yung mga enabling, yung mga ganon. Yung mga ganon pa yung framework
noon. At saka noon, ano pa yun noon, yung nursing process.
Opo ma'am, nursing process. Saka yung mga 3 groups of competencies. Yun pa yun noon. Hindi pa siya dun sa 11K areas of responsibilities. Ma'am, ito maganda rin po yung tanong. Paano daw po kung maging conditional siya this November? Makakapag-take daw ba siya next year ng required lang na test considering na iba na ang framework? Interesting.
Interesting. I'm sorry, I cannot answer that.
Wala pang guideline.
Yeah, wala pang guidelines doon and it has not happened yet, no? Okay. So, yun siguro kasi iba na ang iba na yung ano, although I know that we harmonized it with the 11 key areas of responsibility or doon sa 4 qualifications of competencies, no? Pero I do not know kung how they will do it, no? Okay? Kung papaano na yung kung community health nursing pa din ba, ganon, no? Okay. But I'm
Opo,
sure
ma'am.
ganun pa rin ako, community health nursing.
Okay. Ma'am, may magandang tanong po siya dito. Paano daw po pag NP4 lang siya mababa? Ang gusto ko lang tanungin din, categorically, ano ibig sabihin ng mababa? Is it below
Yeah.
60? Is it below 75? Please do clarify your question.
Yeah.
Kasi kung above, I think kung above 60 naman yan at ang general average ay 75 pa rin, pasado, di ba ma'am?
Pasado, yeah.
Oo. Pero pag below 60, below 60 yan.
Below 60,
Pag below 60,
condition.
conditional. Okay.
Conditional, oo. How many times can I take the NLE if the new nursing bill becomes a law before I become an RN? Okay? If the nursing bill will become a law, you can take the NLE for only 3 times.
Yes,
3 times only.
Yes, ma'am.
After that, you will take a refresher course. No? Pero unfortunately, nasa Senate pa yung nursing bill. Ano? But I think matagal pa.
Matagal pa yun, ma'am, kasi
Matagal
election
pa.
na eh. So baka
Kasi election na. Ano?
After election, new
Yes.
government, new priorities.
Yes, that's right.
May examine po na nagtatanong ilan dapat daw ang score per subject. Na I think nasagot na ni ma'am kanina ito. Yung ilan dapat yung score. It depends on the performance of the group as Ma'am Glenda mentioned early on.
Kinukuha kasi yung ano yung mean, tapos yung mode.
Apo.
I heard kanina si Dr. Gapos talk about the mean mode, no? So kinukuha yung mean at saka mode, yung measures of central tendency is taken into consideration, no? So yung mode and saka mean, no? Okay? So alam niyo yung mode at saka mean. Okay? Post NLE procedures. Okay, I think so is attendance to a formal oath-taking ceremony a requirement for the filing of license? No? Okay, yes, ang oath-taking is a requirement for registration. No, you register muna so that you will be issued a license. You are issued a license only once. No? So yung license number mo, it will be yours forever until you die. No? What you are renewing is the ID. Yung ID mo, which bears your license number, yung license mo parang diploma yon na nandoon yung ano mo, yung iyong license number, no? Okay? Malaki yun na parang diploma. So you are issued an ID which you renew every 3 years, no? Okay. Are there any alternatives for the formal oath-taking ceremony? When you say formal oath-taking ceremony, yung bang yung mass oath-taking, no? Okay? You can take your oath even individually, no? Okay? Can nurses take their oath from a lawyer or authorized person? Not from a lawyer, but from an authorized person, yes. A barangay captain can administer your oath of office, no, because he is an authorized person, no? Okay, a judge, a mayor, no? Okay. But ang talagang mandated to administer the oath taking are the members of the Board of Nursing. Okay. Can I take my oath from any government official? Yes, you can. No. Yung any government official na authorized to do legal functions. Okay? Kasi merong government official na head ng head, for example, ng isang office, I don't think they are allowed. But like for example, in embassies abroad, no, in a consular office, the consul can administer the oath. They can administer wedding, no, consul or vice consul, pero not all official. Okay. Is virtual oath taking valid? Yes, it is. No? What is important here is the oath form. No? You are given an oath form that will be signed by the administering officer. So that is the one that you submit to PRC for registration. Okay, it's downloadable from the PRC website. Okay. Is IB training prerequisite to local employment of nurses? No, it is not, but this is institutional. Okay, so if the institution or if the hospital requires an IB training, then you have to have an IB training, no? Okay. Institutional yun, no? Okay, is continuing education required for PRC? Yes, it is. You are required 15 CPD units as of now, no? But under the law, it is 45 CPD units. Okay? Ngayon, because it is pandemic, they require only 15 CPD. Okay? What are some regulations that will have an impact on our opportunities as nurses? Some regulation, the travel ban, no? Travel ban to some countries like Africa and those countries that have civil conflict, no? Okay. And then of course, probably yung although this is not in effect yet, no, later on yung career progression probably will impact our opportunities for employment, no? But it will have a positive impact yung career progression. Okay? Career progression and specialization. Okay, so thank you. Good luck and God bless all of you. So do you have other questions?
Ma'am, may nag-share na po, Ma'am Glenda, ng site nung saliva test. So nilagay ko na po dito. I think some of those
Okay.
who are interested to check, you could actually log on to the survey site.
Okay.
Thank you for
Thank
the
you.
one who shared it.
Yes, thank you also Miss Glenda or Ma'am Glenda for of course enlightening our participants this morning. Maraming natutunan of course. Iba nga diyan gaya ng sinabi namin ni Dr. Ray kanina na talagang anxious sa pag-take ng minsan nakakalimutan yung mga simple guidelines or yung basic guidelines going to the examination, yung RT-PCR, baka mamaya sa sobrang kaba nakalimutan dalhin yung receipt or yung kailangan ng application. So wag niyong kakalimutan 'yon kasi if ever ayaw naman natin masayang yung opportunity, 'di ba, to take the nursing licensure examination. Kung si Sir Ray kanina ang nabanggit niya is this is the moment. Ito yung para sa yung final countdown. Oo. Punta naman tayo sa Europe na banda. Final countdown siya. All right? Counting down towards your NLE next Saturday and Sunday. All right? So,
Sunday na ba? Yeah.
Oo, ma'am, malapit na.
Be sure yung lahat na nyo, kailangan nyo, it's in a folder na safe, no? Yung magandang folder, no, na merong takip, no? Na hindi malalaglag. Okay, then you be sure that you have a checklist, no? Yung notice of admission, yung receipt mo, or kung yung pencil mo. Pencil is number 2 ba?
Yes, ma'am.
Okay. So, ilang pencil dapat inaano?
Ma'am, dapat sa isang araw, kahit 5. Kasi ma'am, pag naputol yung tinasahan, para hindi na sila mag-sharpen doon.
Yeah.
I think they have to have ready na 5. Tapos may tasa na dapat. Hindi na dapat sila doon nagtatasa. Kasi that takes so much time.
Yes.
Okay.
At saka wag masyadong wag masyadong matulis.
Opo. Nagtatanong po sila, allowed po daw ba magdala ng bag? Okay. I think yung bag, ma'am, I think allowed magdala ng bag pero hindi ipapapasok sa loob ng room. Iiwan nyo yan sa labas. So I think that's very dangerous to do. So if I were you, hindi na lang ako magdadala ng bag. Kasi hindi din yan kayo papayagang ipasok nyo yung bag nyo. So nasa labas lang yan.
Okay. Ayan. For clarification, tama. It's 21-22. Apologies for that one. Sunday, Monday pala siya.
Sunday, Monday.
Sunday, Monday.
Oo, Sunday and Monday. Tama kayo. November 21, 22. Mali lang yung araw na nabanggit ko. It's Sunday and Monday. Sanay kasi ako pag-test, usually Saturday.
Baka merong nagme-menopause, sabi niya, pasintabi po, pwede daw ba na magdala ng small fan? Ma'am Glenda, allowed ba yun? Baka nag-hot flashes, magdala daw ng small fan. Kasi kung ba hindi daw aircon yung room.
Hindi mga aircon yung room, no?
Opo, hindi po. Based on my experience.
Pero well ventilated supposed to be, no?
At saka konti lang po ang laman naman per room. So, I think hindi naman po summer ngayon so hindi naman po siguro mainit. Opo.
Yeah.
Yes. So, I just have a few questions po dito, Sir Ray and Ma'am Glenda. Baka pwede pa nating sagutin. Ito, very general questions lang before we end our event for this morning. So, meron po mga concerns dito kasi matagal na daw nag-graduate. Parang nung huli po nating matagal na daw po nag-graduate, wala na daw po sa kanila yung kanilang attire. Possible, daw po pa kayang alternatives ang pwede dito sa yung mga matagal na daw pong nag-graduate. Yung iba daw, hindi na daw kasya sa kanila.
Yung uniform.
Yung uniform.
But it should be white. So probably siguro pwedeng pants na white and but not t-shirt, no? Blouse talaga na white and
Ayan. So mga nagtatanong dyan na matagal na nag-graduate, hindi na kasya, pwede kayo may alternatives. Basta make sure, masabi ni Ma'am Glenda, na white and yung presentable. Kasi pag t-shirt, di ba,
Yeah.
hindi naman siya parang, hindi pa siya presentable, especially if you're taking the exam. Although komportable siya, but syempre you have to also blend in. Dapat talagang itsurang healthcare professional or nurse. Ayun.
Yeah.
Ito, Sir
Oo.
Miko, napakagandang tanong eh. Oh. Paano daw po yun, Ma'am Glenda, yung hindi nakakomply, yung PRC requirement na 5
Yes.
cases sa DR, 5 sa NICU, 5 major and 5 minor. I think this is a matter that initially, from my own opinion, dapat ina-address muna ng CHED. Kung
Yeah.
ano ba yung pwede nilang alternative na
Ang
gawin.
school.
Kasi, di ba ma'am, sa inyo, ano lang, oversight yung powers
Yes.
nyo regarding these requirements, just making sure
Yeah.
that they had complied. But the modification should come from CHED.
Yeah, di ba this it was it was a requirement for graduation already. Noon kasi it's just a requirement ng Board of Nursing. Pero
Opo.
ginawa ng CHED, you are right na dapat concern yan ng CHED.
Opo.
Kasi ginawa yan ng CHED na di ba, requirement for graduation na.
Opo.
Kasi nga maraming problema with regards to that. 3 na lang nga ngayon hindi na 5.
Siguro ma'am, moving forward, if ever in the future, baka pwede nilang gawing simulation na rin based on may simulation standards, mag-take na rin
Yeah,
lang ng parang
oo.
OSCE. Kasi ma'am, naalala ko yung sabi sa Amerika, hindi naman daw nila nire-require na actual. Basta dapat may demonstrate nung nurse yung skill. So, yeah, kasi ma'am, minsan, di ba, naalala mo, pag kinulang na ng case, hinawakan lang yung ulo, kukunin na yung hospital number, actual na. So, hindi naman talaga nagpaanak.
Di ba nga yung issue na na yung they don't really understand what is a competency-based curriculum. No? Kasi, yun nga, you don't need really 5, that's why sabi ko na, kasi halimbawa yung infection control, no? What are the competencies sa infection control? No? Hindi naman lahat doon lang sa OR scrub mo yan di ba? You can yan sa wound care.
Wound care, opo.
Di ba? So yun ang lagi kong sinasabi, the late DOH Secretary si Juan Flavier. Sabi niya, yung mga nurses na yan, tsaka mga midwife na yan, gawing-gawi competency-based, but they really do not know what competency-based is. Kasi di ba, mastery yan di ba? As long as you have not mastered the competency, hindi ka dapat pumunta sa next level. Which is very expensive naman.
That's true, ma'am. Kasi ma'am, yung simulators kasi ma'am, nagre-recalibrate at mahal naman po ang recalibration ng mga mannequin. So you talk about hundreds of thousands. Pero kung competency-based talaga tayo or outcomes-based, mas maganda talaga na ma-demonstrate kasi iba lang po yung documentary compliance. Ayun, meron siyang case na actual, hinawakan lang yung ulo. Pero baka pag nagkaroon na ng case na magpapaanak, hindi niya alam ang gawin kasi hindi naman siya talaga nagpaanak. By record, meron lang siyang case number nung case, pero hindi naman siya yung, that's the problem right now, and it's gonna become, it's gonna escalate.
Yan din nga, Doc Ray, yung ko noon na yung a lot of faculty cannot understand yung conceptual yung conceptual method at saka yung competency based, no, di ba? Like halimbawa na ang concept mo is your concept is yun nga, infection control. So sasabihin lang nila sa OR, sabi ko, even kung nasa ang kang ward, no, kasi nahihirapan silang mag-assign ng, hindi ang concept kasi ganito, pwede mo naman kahit saang concept yan, kahit saang
Tama
word,
po.
pwede
Tama po.
yan. Oo.
Tama
Hindi
po.
nila
Basta
yan
may
maintindihan.
may application.
Yeah.
Kaya nga ma'am, ang sarap galawin yung
Yeah.
yung curriculum Gawin na nating
Curriculum, totoo
constructionism para outcomes based talaga.
Yes. Oo. Yan yung gusto ko din. Oo. I enjoy talaga yan. Meron
Oh,
pa,
ma'am.
Miss Ternico?
Yes. Yes,
Ano
meron
pa?
pa pong mga questions. Opo, meron
Oo.
pa po tayong a few questions dito na pwedeng
Yes,
sagutin.
sige.
We can only take the nursing board exam thrice po. So what happens if you fail 3 times? Ito, ma'am.
Siguro i-contextualize natin yan. Yung nabanggit ni Ma'am Glenda kanina, if the new nursing law will be approved.
Yeah.
Oo.
Yung
So,
nursing law.
if yon, yung sa ating mga attendees.
Oo.
So, as of now, hindi pa yan. Hindi pa po.
yan.
Oo.
Oo.
Pero sir, Sir Ray, Ma'am Glenda, may idea ba kayo or talagang wala pa? Wala pa at all?
Nung panahon namin, yung old nursing law, ganyan After maximum ng 3 tries, magre-refresher course ka sa level 4 ulit. Papasok ka ng 1 year in the major
Pero parang
subjects.
hindi natuloy, no?
Oo, hindi na. Yung nung time namin yun, ma'am. Pero nabago na nabago. Hindi naman strictly na implement. So,
hindi na implement kasi hindi nila alam kung saan magre-refresher.
Opo, at hindi rin nila alam kung sa school ba kung saan sila graduate magre-refresher o kung ready ba silang tanggapin ng ibang school sa refresher. So maraming mga nitty-gritty na hindi na-resolve.
Yes.
Opo.
Ayun. Okay, sige. So thank you very much, Sir Ray and Ma'am Glenda for that. Yes, most of the questions na nandito pa sa ating chat and Q&A are those na nasagot niyo na po.
Nasagot na.
Post na presentation. So I think hindi lang po siya kumbaga siguro nakuha ng but most of the questions here na nakikita niyo were answered already during the earlier portions of our Q&A. So again, this has been your host, Miko, and joining me again is my co-host, Drea. Thank you very much for attending our NLE Masterclass. We wish everyone luck and have a safe day ahead.